Hello, good evening, everyone. Again, thank you so much for coming, and congratulations for making it through the most difficult bit, which is the MSRA. Because before the MSRA, the competition ratio in radiology one of the highest among the other specialties. So uh, it's reaching up to 12 to 1 or 14 to 1, and this is basically the number of applicants versus the available seats offers. So now you made it through. From now on, the competition ratio is 2 to 1. So every two candidates, they are competing over one post or one offer. So you have 50% chance initially. That's before you start working hard and before you getting this orientation. And by the end of this presentation or the end of this session, I hope you are more confident, your chances are getting higher, and you know what to do. I know it's just 1 week till the first day of the interview period, so we should not waste anyone's time. And I hope it's just up to the point. So let's start our presentation. So our agenda today, we need to know facts about the interview because they've changed the interview from last year. Because I've gone through the interview twice, last year and the year before, so they've changed that. And it is like I believe it's like a dynamic process. Every 2 3 years, they are changing the format of the interview. So the last 2 years, 2025 and 2024, they were the same, but the year before it was different. So we need to know these facts, and there are like very critical numbers you need to know. And on the day of the interview, there are like things that are essential. You have to fulfill them. And what should you do for the rest of the remainder of the time? And you need to have some some practice, real-time practice for the interview. How do you want to formulate your answer? And at the end, because today I meant to have my consultant with me, who is like an ex-panelist. He was interviewing in ST1 interview for many times, many years, but for last minute, I think he couldn't make it. But I got his slides and integrated them in this presentation. So this is the first thing that you need to know. Let's start from the top left. The interview station, during the day, you will enter into like a lobby, and you will be waiting for 10 minutes. Why? Because this is the new station from last year. It's the station of portfolio. If you can see on the left column here, the interview format is station A for 15 minutes and station B for 15 minutes. Last year it was 10-10. So the total time of your interview is 30 minutes. You will have 3 questions in each station. So you have 6 questions in total. Okay. So before you start the first station A, the first question, before you start, you'll be waiting for 10 minutes. Why? This is again a new change. One panelist will be going through your portfolio, the evidence you have uploaded, in just 10 minutes. This is really time stressing. So he will go through the domains, the 5 domains that you have uploaded, and you self score yourself. So give yourself A, B, D, whatever. He will check that. Then, if there were any discrepancy, he want to downgrade you or upgrade your marks, he will ask you 2 questions in these. If everything was in place, now he will ask you 2 questions in your portfolios. For example, an audit you have done, master you have done, tester week, something like that. They will ask you 2 questions. This is not a brand new station. It's a new station in comparison to last year and the year before, but it was there 3, 4, 5 years ago. This question was there, so it is not a brand new thing. Why this is significant? Because you will have some literature, you have some books, you will have some previous paper, you have something like that to study from. So this is very reassuring, to be honest. So it is new for someone who did his preparation last year and the year before. But there is a literature from the years and the rounds before, And it's very thorough, to be honest. You can go through them and find a useful material. So 10 minutes, you'll be waiting. Then they will ask you two questions. This is station A, question 1. In station A, question 2, they will ask you question about understanding of the specialty, which is very classical question. The year before and last year, and every time it was there, that question, because they need to hire an ST1 who's really understanding what radiology is, what is the scheme of training in UK, so for something like that. So this is like quite a classical question. Then the third question in station A is skill question. What does that mean? You go through the personal specification. You know there are some skills, transferable skills. As a ST1 radiologist, you have to have them. So these skills will be either like direct question about one skill or generic question. So it's around this. Again, the literature is very thorough. You will find so many questions and so many answers in this. If you've done any courses, if you've gone through any box. So these things are very common, and the literature is there. You'll have so much material around all of these A1, A2, and A3. This is now the first 15 minutes. Then sometimes you'll have 5 minutes break. Why? Because the panelists, you will be marked by two, Dr. A and B in station A and Dr. C and D in station B. So they are different people. So you will be marked by 4 different people, 2 in station A and 2 different in station B. So they are different people. And every single question, you will be given like a mark out of 5 by one panelist. So for example, let's say question A, 2. It's out of 10, 5 marks from this panelist and 5 marks from the other. So you can score, for example, 3 with this person and 4 with that person. So your total score is 7 out of 10, something like that. In station B, again, they will ask you a clinical question, clinical prioritization / trauma scan. They might give you, because last year, the application for Northern Ireland was different from the rest of the UK. So Northern Ireland candidates, they got a question of trauma scan. They will give you a report, like an CT report, trauma CT report. Head is that. Chest showing, for example, bleeding hemothorax. Abdomen showing retroperitoneal, something like that. And they will tell you, what would you do? So the question in B1 is not like a radiologist. You are just like a generic SHO. What would you do in terms of that emergency situation? This was for Northern Ireland. For the rest of the UK, our application, it was prioritization. They will give you like 5 requests. You are a radiologist, and you have 5 requests. Which one would you vet first, approve first? Okay. This year, is there any guarantee you will have prioritization or trauma report? No. Yeah, because they merge together, the 2 applications. So you might have 5 requests, 5 scenarios to arrange them. This is more important. I will start with this. Or you might have that CT trauma report and you manage one patient. Again, because this is the 3rd year in a row that we are having such a scenarios, you will find some literature again. Maybe station B1 question is carrying the least literature available, to be honest, because it's something brand new, relatively, for 3 years now. 2, and this is the 3rd year. You will find something like that. And during your practice, as we are going through the slides, you need to practice something like that. And there is a specific reason for this. You will find the specific reason in this slide. So let's go through. Again, question B2, classical question, coping with the pressure. And B3 is question about team involvement. Look at the right side of the slide. The appointable criteria will be as follows. Number 1, a minimum score. I copied, pasted this from the official website. The formatting and the dot and start of the new sentence is really jumbled up, but I just copy pasted from their website. The appointable, you have to know this by heart. The appointable criteria, what does that mean? Even if you pass the MSRA, you might fail the I hope this is not the case. You might fail the interview, so you have 0 chance to get an offer. So to be appointable, you have to pass the MSRA first, which all of us have done now. And even if you are on the reserve list, they might send you an invitation last minute. You have to prepare very well. Then you have to pass the interview. If you fail the interview, you have zero chance to get an offer. You are inappointable. You are not fulfilling the criteria to get an offer. So you have to pass the interview. How can you pass the interview? You have to have a minimum score of 48 overall. So this is very, very important. I've just noticed this point yesterday. This is very scary. What does that mean? So if the interview was 60, you have to score 48. That is very high score. This can't be the minimum to pass. So I've thought again. Last year, the interview was out of 60. The year before was out of 60 as well, and it was 60. So the maximum marks was 60. So if this is the case this year, the maximum mark in the interview is 60 because it's 60% in the overall. We are coming into that, don't worry. It can't be the case. It can't be the pass mark 48. This is very high. How can I need to score 48 just to pass? So I thought I made some comparison with the last year. So they are historically keeping the pass mark of 60% of the total. So if they want you to score 48 minimum, that means the total score of the interview is 80, which makes sense. So station 1, look again back on the left side. Station A, 3 questions. The total score of them is 40. And station B, 3 questions. The total score of them is 40 as well. So 40 mark in station A and 40 mark in station B. Is that something 100% sure? No, I would say 90%. This is like guesswork or extra operation, but I believe it is the case because I compare them to the previous years. The pass mark is 60% of the total. So if they want you to score 48, that means it is the total mark is 80, 40 in station A and 40 in station B, and they are 100% equal. Why? Because look at the sentence after the apostrophe, with at least score of 22 in both stations. That means the pass rate of each single station is 22. That means they are on the same value, on the same marks. So station A, 40 marks, station B, 40 marks. So the total is 80. From that 80, these 80 marks will represent 60% of your total score or percentage. Again, let's assume I scored 40 in total in my interview. I'm failing the interview. I'm not appointable. I have zero chance to get an offer. I need to score at least 48. Okay. Does that mean you need to score 24 in one station? 24? No. You can score 22 in station A, for example, and then 44 or 46 in station B. That's fine. But you can't score. I know one case. He's a very close friend of mine. When the interview was out of 60, the pass rate was 36. You have to score 36 in total, minimum. He scored very, very high in station A. He scored 29, which is very high, 29 out of 30. And in station B, he scored 15. And he failed the interview because in each single station, you need to score 16 minimum. That was last year and the year before. In this year, they changed the format. You have to understand that. You have to score 22 minimum in one station and 48 in total. Okay? So scoring less than 48, 48 out of 80. I presume it's 80. If you are scoring less than 48, you have zero chance. You have to pass the interview. You are not appointable. So the appointability, number 1, minimum score of 48 in total, and minimum score of 22 in each station. Okay, 22 in station A, 22 in station B. Again, you should never score 1 in any question. So you have 6 questions. If you scored 1, that means one of the panelists gave you 0 and the other gave you 1. If you scored 1, you are inappointable. You might say, okay, let's presume in station B3, I scored 0 and 1 with one panelist and 1 with the other panelist. So my combined score in B3, 1. I might score 10, 10, 10, 10, 10, very high score in the rest. This might happen. But again, you are failing the station. You are failing the station. You are failing the interview accordingly. This is very extreme. That means they are telling you, if one of the panelists got so angry with you, so you are faking the answer, or you are talking nonsense, or it was completely throwing them off, if someone failed you and the other one failed you as well by 0 and 1, you are going to fail the whole interview. And this is very rare. Don't worry. You don't need to worry about that. But you need to know at least. The fourth condition for you to be unappointable or appointable, you have to have a combined and weighted, this is complicated, please focus on this, combined and weighted score of 6 out of 10 or more in the clinical prioritization. Again, focus on B1, station B, question 1, this clinical prioritization scenario. This clinical prioritization scenario, as we agreed, it's out of 10. One panelist will give you 5 and the other will give you 5. So my score 4 here and 5 here, so 9 out of 10. It might be the case. However, if you scored 5 in total combined, like for example, the panelist, the first one gave you 2 and the other one gave you 3. So your combined score in, your combined mark in B1 was 5 out of 10. You are failing the station and failing the interview subsequently. It's very risky. So in the that's why when I started my presentation, I told you B1 is the most important question, because you might score 5 out of 10 in A1, A2, A3. That's fine. You might compensate in other station, in other question. But B1, you have to score 6 at least. It wasn't the case last year, to be very honest. They made it very, very tough. But it is tough. You have to understand that. So that's why I mentioned here, you have a better orientation today. You know what to do. You know why are you aiming for. Orientation is 50% of your puzzle. So again, station B1 is very important. You need to score 6 at least. If you are scoring 5, which is half of the score, you are going to fail, unfortunately. So you have to score. So why did they mention combined? Combined means both of the panelists, your mark between both of them. Someone giving you, for example, 5 out of 5, and the other panelist got so angry for your answer, which is very unusual, and gave you 1, 5 plus 1, 6 out of 10, you are safe. So the combined, that what it means. Unweighted, what does that mean? Okay, when I analyzed unweighted and compared it with the last year, I realized station B1, the clinical scenario, is out of 20, not out of 10. How come? One panelist will give you a mark out of 5, the other will give you a mark out of 5, so your final score is out of 10 usually. Then they will multiply that by 2. They are giving more weight for B1. That's why station B is out of 40 marks. Now it makes sense. So B1, the total score, the total mark of it is 20, B2 is 10, B3 is 10, so the total is 40. You need to score 22 out of this 40. That's why it makes sense. Is that applicable for station A? Yes, because they both have the same marks. So A1, I presume it will be out of 20 as well. One panelist will give you mark out of 5 and the other out of 5. So your score, let's say your score is 8 out of 10, 4 and 4. Someone gave you 4 and the other one gave you 4. So your combined score is 8. 8 out of 10, they will multiply that by 2. So you'll score 16 out of 20. That's why you have to understand station A1 and B1, they are very, very important for your mark. If you are losing mark, you are losing the mark times 2. Their weight is heavier than the others. Did they mention that clearly? No. This is, again, a guesswork. But it makes sense. Why? Because the pass rate is 20. This can never be 22 out of 30. It makes no sense. So one station can never be of 30 as a total mark. It's not fair to say, okay, you need to score 22 out of 30 to pass. That makes no sense. So I believe it's 22 out of 40. How come they will make it 40? Because in our case, last year and the year before, the prioritization question was out of 20 as well. We had just 5 questions. Every question out of 5, only this one was out of 20. So when you combine them, it's 60. The total mark was 6 last year. So it makes sense now. They are keeping the same value. That's why they mentioned the combined and weighted. When they do the weighting, it will be out of 20. They will multiply that by 2. To be honest, they should make that clearer. And this might be the case during the interview. I'm not sure. But last year, they made it very clear. The prioritization scenario multiplied by 2. Weighted. They gave double the weight. This year, they didn't mention that clearly. I went through the website. So, number-wise, it makes sense for me. Station B1, the final mark they will get they will multiply that by 2 to make it out of 20, to make the total score out of 40. So the pass cut score is 22 out of 40. Okay? In station E, A, they must do the same because they carry the same weight, the same value, the same marks. Because of the pass score is the same, 22. So it meant to be 22 out of 40. How would they make a 40? Because they are 3 questions. So one of the questions will be having double the value, 20 and 10 and 10. Again, okay, how would they rank us? What is the final score for you? Again, the overall score, it was like going 30, 70, 40, 60, because when they initially announced the change, they said, like 3 months ago, they say, okay, the interview will be weighting 70% of your final score, and the portfolio is 30% only. Then they changed that. I went through the website multiple times, and last time it was like 1 hour ago, just to check the last up-to-date information. They made it clear. They brought it back like last year. So the interview is weighting 60% of your total score, and 40% will come from your portfolio, which makes sense. So the portfolio, you work hard, 30% might be very less for that. However, they made it 40 and 60. If, for example, 2 candidates, they scored the same in interview and portfolio, how would they do? They will use a tiebreaker. Did they mention what was it? No. Some people, they are saying they might follow the GP module by using the SKT. There is no confirmed information. How would they break the tie? We don't know. But they will use something and they will let us know. So these are very important information. You have to know the pass score is 22 out of maybe 40. And you have to score 48 in total. Makes sense to be out of 80 because this is 6%. It makes sense. Don't forget, you can't pass the interview and get an offer at all if you are scoring less than 6 in the prioritization question, which means 12 out of 6, yeah, which means 12 out of 20 after they weighted, after they multiply by 2. So you can't score less than 6 out of 10. You can't. If you score 5, 3 and 2, for example, you are failing the station, you are failing the interview, unfortunately. It's really tight, you have to know that. Okay, so this is, for me, the most important slide, this and the other one in this presentation, because you have to have a target, you have to have a figure, you have to have a score that you need to achieve. I'm that type of man. I need to know what is requested from me. What should I do? So I went through UKRC website and UKRC WhatsApp group. They are very useful resources and free. So I really thank them. What was the most important thing that I found there? I found the 2 most competitive academic year were the last year and the year before. The competition was crazy. Why? Because the competition means the posts are very less and the applicants were very high. It makes sense. So in 2024, not the last year, the year before, the initial posts, ST1 posts, there were 293, as you can see. And the people applied, there were like 4,000 or something, or 3,900. Then the final post, because they will initially offer 293, then every 48 hours after the offer start to come out, they might add some offers, because some of the ST5 doctors will finish their ARCB, then they will free one slot, something like that. So the offers might increase with time after the start of the offer timeline. They might add some offers, some posts. So they started with 293. So focus on 2024 column. So they started by 293, less than 300 posts. However, when they first announced the offers, the least score who got an offer initially in the first wave, because there is a wave of offers every 48 hours. Why? Because some people might reject the offer, some people might go to other specialty, something like that. So they recycle the offers every 48 hours. However, the first initial wave amongst these 293, the least candidate who got an offer initially was scoring 71.9 total score, and his rank nationally was 321. So there were 293 offer, but the one who was number 321 got an offer as well, because some people in the middle, they just quit the radiology, they went somewhere else, something like that. And his score was 71.9. That means if you are scoring 71.9, you are definitely going to get an offer, inshallah. Why? Because during the most competitive year, when the offer was the least, very, very few offers, just 290, someone who scored 71.9 got an offer already. But the process was going on. Some people are withdrawing the offers, rejecting, going somewhere else, and they keep adding more posts till they reach 312, which is very, very low number, by the way, very low, 312. So the least candidate, or the last candidate who got an offer, was scoring 69.6. And believe me, these percentage, the decimal numbers after the point is very important, because 30, 40 candidate might share the same 69 point. So 69.62, not like 69.67. Believe me, these very decimal numbers are making big difference. So in the most competitive year, the one who scored 69.6 got an offer, and his rank was 370. The next year, last year, 2025, was a little bit less competitive. I wouldn't say less competitive, but the offers were more. So we started with 326 offer. We ended up having 340 something offer. So the average is to have 350 offers per year. But because of budget issue and things like that, they might go less. However, so the offers were a little bit more. That means they are getting more people. So initially, the one who scored 69.667 got an offer. The offer were 300. The posts were 326, but his score was 348. So like 20 people, they just withdraw the offers, and he got a chance. Because a lot of candidates, they apply for radiology and, for example, anesthesia, radiology and general surgery, radiology and ophthalmology, as you know. So by the end of that waves, till the last offer, it was, I think, in June, the one who scored 67.9 got an offer. His rank was 383. So maybe 40 people in the middle, they withdraw their application. So what I'm trying to say, why I'm mentioning all these numbers, just for this. It is never the case, it has never been the case, someone who scored 70 and got no offer. Never. Could it be the case in this year? Maybe, but very, very unlikely. So what I'm trying to say, if your total score was 70, you are on the safe side. Do you want to make it more safe? Score 71%. This is very important information. Why? For some people like me, last year, my portfolio was not the best. People are scoring, the portfolio last year was out of 45. People are scoring 40, 36, 38. I scored my self-assessment 32. They gave me 27 or something. So my portfolio was just in the middle, 27 out of 45. So something like below average, to be honest. So I needed to work very, very hard in the interview to compensate for that. Again, if you are scoring very low in portfolio, it's not the end of the world. Why? Because there is no pass-fail in the interview. Whatever your score is acceptable. Unless you are scoring E all of them, they will exclude you before you are getting to the interview. However, there is no like minimum cut score in portfolio. Even if your portfolio was very low, you could compensate in the interview, because the interview by itself, 60%. If you scored 55 of this 60%, for example, that's very, very high, you are making a big difference. Again, you have to know your aim is to score the highest, to be the best, but you have to be realistic. If your portfolio was a little bit below average, you have to know your aim is to score 70 at least. If you are scoring 70 in total, you are in the safe side. So let's work that out. Someone, for example, had a very, very bad score in the portfolio. Let's say this year the portfolio was out of 24. So if you are scoring 24, you are scoring full mark in portfolio, but that's very difficult. Someone, for example, scored just 10 out of 24. The first example. I scored 10 out of 24 in the portfolio. That means my weighted portfolio score, because the portfolio is out of 40%, isn't it? And the interview is 60%. So if I scored 10 out of 24, that means I scored 16.667%. What does that mean? That means I need to score the interview. If the interview was out of 80 marks, I need to score 72 out of 80. So my total would be 70%. So I'm in the safe side. This is a very good example. Someone who did not work hard in the portfolio, you still have a chance, but you have to know. If you scored, for example, 10 out of 24 in the portfolio, you scored very, very less. You scored 16.666 out of 40. That's very low. Can you make up for that? Yes. If you scored 72 out of 80, if it was 80, I assume it's 80. If you scored 72 out of 80 in the interview, which is very high score, you are reaching 70% in total. Your total will be 70%, you'll get an offer, inshallah. Okay? What if I did very well in portfolio, I worked very hard, I scored 20 in my portfolio, 20 out of 24. How that would weight in my scale? 20 out of 24, that means I'm scoring 33.3 out of this 40% that is designated for the portfolio. So I'm scoring 33.3 out of that 40%. How much do I need in the interview out of 80? So my total score would be 70 and I will be in the safe side. You need just 49. What does that mean? That means you need just to pass the interview, because the pass was 48. Don't forget this figure. The pass rate, if you can look here on the right side, the pass rate is the pass score is 48. So if you scored in your portfolio 20 out of 24, that means you just need to pass the interview. Just passing the interview automatically will give you an offer. Why? Because you scored very, very high in the portfolio. That means if you scored very high, your aim should be, I need to rank in the top 10%, top 1%. Why? I choose the place that I like, the specialty that I like. Some people, they are aiming for intervention radiology, for example, and there are like 20 posts only, like ST1 run through intervention radiology. If you are aiming for that, you got to score very high in the portfolio, very high in the interview, you'll be top 1%, something like that. Again, let's go back into this. If you are scoring very low in the interview, in the portfolio, you still have a chance. Yes, the interview carries the bulk of the marks. You need to score very high, up to 72%. If you are scoring, for example, not 10, you're scoring 15, you are in the middle. You don't need 72. You might need 60 out of 80, something like that. So you have to know your aim and your goal, and you have to be realistic. If you are doing very well anyway in the portfolio, your aim is not just to get an offer, to get the best place that I like. Because it is competitive, you have to know that. If you are scoring low, you still have a chance. You need to master the interview. And that's why you are here today. So, what do we need to know? Were there any pitfalls or major mistakes that I might do in the interview day? Yes. I'm telling you from personal experience and accumulation of different people's experience. First of all, this is one of the most important days in your career at all. Getting into radiology is a big milestone in your life, and it's not easy. You made the most difficult bit by passing the MSRA, the SGT. Now, you should not do less to yourself. You should not do injustice. That's very, very, I would say, unwise. So take that day off. I'm telling you from experience. If you are working and you are planning to take maybe 1 hour break to do the interview, that is not enough. Because number one, patient safety. You will be double-minded. You'll be thinking about the interview the whole day. How would you take care of your patient? That's not professional enough, I'm telling you. Number two, you cannot be in because interview, as we are going through this presentation, you will know it's a mental game. It's like a skill that you might never be testing before. Skill of learning the answer, memorizing the answer, and how would you communicate the answer. This is a very different skill. You need your brain to be in the maximum like mental status, the best status of your mind. So you can't be occupied by working day or something like that. That wouldn't be the best for you, because you are competing with the people who are taking annual leave or whatever leave, and they are very well prepared for that. So don't do less to yourself. Take that day off, please. It's just 1 day, so try to take it off. If, for example, your interview in the morning time, you don't need the whole day. You might take half a day off and then work afternoon. That's fine. But don't work before your interview. That is going to minimize your mental status, I'm telling you. Number two, please check the connection and these logistics. They are very fair. If the connection, when disconnected or anything, they will give you your time, but you will be in a very anxious status. I've seen that last year. Why would you put yourself in that unnecessary anxiety? You don't need to be. You need to be the best of you. So check these things. That's easy things. They will send you a link. I think I forgot the name of the website. So you go through them and you check your connection, you check your camera, check everything, please. Number three, try to impress them. Remember, you are not the only candidate. There were like 700 candidates. You need to impress them. You have not to do less. What does that mean? If you are attending the interview, everything counts. Body language, the way you speak, the way you are dressing. So you get to dress smart. You have to be as professional as a ST1 radiologist. So everything counts, believe me. You can't compete with the people that all of them were very professional, wearing full suit and something like that, and you are wearing a t-shirt. That's not fair. I can't wear t-shirt now. That's just something free webinar. But if you are attending the interview, please look as professional as you can. Make the background very white, something like that. Don't make a lot of things. So try to tell them I'm very professional. I take into consideration everything. I'm just as professional as you. So try to deliver this message. Okay. Okay. So we've spoken about two stations, station A and station B. We know station A is 15 minutes and station B is 15 minutes as well. So they carry the same weight, they carry the same marks in total, 40, 40. Let's assume they are 40 and 40. So station A1, as we agreed, this is a portfolio question. He will have 10 minutes before that, reviewing your evidence. Then he will ask you, one panelist will ask you two questions. Sorry, one panelist will review, and then they will ask you two questions. There might be one panelist, but there might be one. What do you want to know? You need to know this station most likely carries weighted marks. So whatever you score, which is 6, 7, 8, 10, 9, maybe, they will multiply that by 2, most likely. I think this is the way. So this station, A1, carries 20 marks in total. That's very important, okay? And you'll be asked two questions in your portfolio. What could you do wrong? It's easy because these are things you have done. If you did a mistake or you mentioned incorrect information, that might tell the examiner or interviewer that you are lying, you are faking. You didn't do these things. So you got to know them by heart. So station A1, the trick about it is to know the thing that you have done by heart. You have to speak in a very confident language that I have done this, I've done this. The information was this. The presentation was at that time. The outcome was this. We discussed. You have to be very confident and you have to tell them, I'm not lying, I'm not faking. These things have been done correctly, the right way, and I've done them because you are claiming something. So the mistake here would be a fatal mistake. If someone gave you 1 or 0, believe me, you are going to fail the station. So it is an easy marks because this is something you have done, but the wrong way is not to know them by heart or to do a mistake that might tell you are not genuinely doing them. You have not been genuinely doing them, so this is a fatal mistake. You have to understand that. Okay? As I told you, multiply the marks by 2, so you'll be marked out of 20. And station A2 is a question about what? Understanding of the specialty. This is a very classical question. They might ask you about, tell us about radiology, tell us about radiology training, tell us about the RCR exams, FRCR exams, might ask you anything around the radiology in the UK. So they might ask you, do you know what is for example, the day-to-day activity of radiology training? So in station 2, the skill is not something you have done, something that you know about the training here, about the radiology here. So how would I get the hang of that? You have to familiarize yourself with the RCR, Royal College of Radiologists. They have a very good website. You can register in that website even if you are not trainee, and you get that information. So in the RCR, you might type ST1 curriculum, or for example, radiology training curriculum. So you will go through them. You know there are 3 exams. When you will need to sit to these exams, what are the nature of these exams, the material, and the pattern, things like that. So you have to familiarize yourself. So station A2 is totally something that you don't know, and no shame on that. You will learn that. What is the curriculum? What is the portfolio? Because in radiology training, you have a portfolio file in a very specific application called RISR or Kaizen, one of them. So they are the same thing. So you have to know these things when you are speaking. You got to be very smart. Got to mention things like that to show them. Oh, I've gone through them. I've literally done a test replacement in the UK just to taste the radiology, to know how does it look like. I'm not just here for some reason. I'm here because I liked it and I went through all of these things. So you got to be very smart. So you got to know these things, and they will ask you a direct question. So this out of 10 marks, 5 by one panelist and 5 by the other. And the last question is station A, station A3 will be question about the skill. How would I get them? Go to the personal specification. Go to that website and see the personal specification of ST1 radiologists. Go through the skills. They're asking about specific skills, know them. Can I use AI here? Yes, that's very good. You can ask AI, how can I, for example, answer a question about these skills? Don't be ashamed. While you are preparing, you can use all tools. But by the way, they've added something in the website. You can't use AI during the interview, which is common sense. No, I believe all of us know that. You can't use AI during the interview. This is like cheating, but you can use it beforehand. So, as I told you, question 1 is something that you know by heart, but you got to be smart. Question 2 is something you will learn. Question 3 is something is there. You just got to familiarize yourself with the skills like, for example, teamwork, skills like, so there are many generic and specific skills to the radiology. They are all there. Just copy paste them and try to figure something out when they are asking you. We're going through this as well, so don't worry. So again, I believe the station is 15 minutes. Usually, we tend to do questions like A2 and A3 in 2 to 3 minutes. This is the time. Because last year, as I told you, we had 3 questions of them in 10 minutes. So every question is 3 minutes. Then at the end, they will ask you, do you want to add anything? So it makes sense to keep it the same. So question A2 and A3, 3 minutes, 3 minutes. That means you will have like around 8-9 minutes for question A1, because this is the add-on question from the last year. Last year, we had 10 minutes, 3 questions. They were all like A2, A3, so 3, 3, 3. However, if you are giving the same weight now, question 2, 3 minutes, question 3, 3 minutes, that means you are having 8 to 9 minutes for question 1. That's why it is weighted, carries more marks. It makes sense. So they will ask you, for example, one question about an audit you have done. You have to speak about that in 3 to 4 minutes. Another question about something else, you have to speak about that in 3 to 4 minutes. So you will finish in 8 minutes, some kind of thing. If they want to do something else, they want to prompt you, they will have some, like 1 minute. They will ask you, what about this? What about this? If you are doing well. So keep 8 minutes for question 1, 3 minutes for question 2, 3 minutes for question 3. Okay? So for station B, 15 minutes, exact same thing. In B1, it is the prioritization question, the tricky one, that you, it's not tricky because of it's difficult, no, because you need to score 6 at least, 6 out of 10, which is 12 after 20. I believe they will multiply that by 2. That was the case last year. So in this question, last year we were spending, because last year station A was this question plus question about understanding of the specialty. That question will take 3 minutes, and this will take 7 minutes. So if you are keeping the same mentality here, prioritization question or trauma scan report will take 7 minutes, 7 to 8 minutes. Let's say you are doing, because they will give you 5 cases and they will give you 1 minute to write something down. Then when that one minute of preparation finish, it will tell you, now you can start. So you talk through the things. You don't say, okay, my answer is this, this, and this. It's not like ranking, no. You say, I will start with this because blah, 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 blah. And we are going through this, don't worry. Again, question B1 will take 7, 8 to 10 to 9 minutes, not more than that. Because you got to control your own time. If you are overstaying in one question, they will not going to say anything. You are just wasting your time. You are not having any time for the rest of the two questions. So you got to manage the time. So question B1 in 7 to 8 to 9 minutes maximum. And this mark will be multiplied by 2. We weighted into 2 marks. The skill here is how would you talk through things. You should not say, okay, my answer is CTA, PFS, then MRI brain. It's not like that. You should say, I will pick the CTPFS because I suspect this. The scan will do this, this, this. I'm out of hours, so I don't have MRI now. Something like that. You have to talk through. Clinically, I will ask them, have you done any D-dimer? Okay. Was there any ultrasound done? Any blood thinner have been given? Something like that. You have to talk like you are not a radiologist. You are being asked like a competent SHO, generic information about everything. Yes, you are acting like an ST1, but the knowledge that you need, not like you are a radiology registrar. No, they don't need that. They are going to teach you that, don't worry. But they are asking, are you safe doctors? Do you know medicine? That's the whole point. This is in station B1, okay? In station B2, you will have, again, a question about coping under pressure, which is literally SJT scenario. You have done very well in SJT, you passed the exam, you are here now. So it is like, this is like a example from the official website. A surgical registrar does not feel your provisional diagnosis during on-call reporting is correct. How would you deal with this? This is typical SJT. I believe you've been through so many similar questions like this in SJT. So it is an application, practical or verbal application of your SJT understanding. Here, you don't have to rank questions. You have to talk through. You have to say, okay, you have to be very smart. You have 3 minutes. This question this scenario might represent patient safety. I'm not sure if I'm missing something. So try to be smart. Tell them in indirect way, I'm focusing on patient safety. I'm junior. I might do mistakes. I need to escalate to my senior. Something like that. Tell them you are safe. Tell them you are a reflective person. Tell them you are going to seek help. Tell them you are open for feedback. They might make it very hard. The surgical registrar spoke bad about you. What will you do? Something like that. So stay patient focused. Stay, let's say, impartial, as professional as possible. Something like that. So this is just a typical SJT scenario. The last question would be B3. Again, 3 minutes, 10 marks. Give us an example. So it is like a teamwork. So they'll ask you like, the team was working together. What was your role? Or team was underperforming, or the team felt pressurized, something like that. It's about teamwork. Again, it is like kind of SJT scenario as well. For B3, the way to work out, you have to prepare responses, to be very honest. You have to prepare answers beforehand. Again, you have to have a different skill for each question. A1, this is something you have done, you have to know by heart. Question A2, you have to learn new things about the radiology, the training, the UK program. This is the new thing. You have to know them. A3, it is about something there in the website. You have to see them, to know them, and to sort something out, some response. Well, how would you make an answer for yourself? And you can use AI, as I told you. In B1, this is a pure clinical knowledge, but don't forget, in B1, it's clinical knowledge, but you have to have some radiology touch. What does that mean? In radiology, we have like some codes for trauma, some codes for minor trauma. You have to know, not you have to, if you mention them, you are looking smarter. You have to say, oh, silver code, whatever, something like that. You have to know them as well. So you know the clinical information from radiology perspectives. And you have to say, okay, this is a possible stroke. In radiology, we must report that in 1 hour. So they need to do it now, and I must report it now because time is brain, for example. These are like very smart phrases. You've got to be a competent SHO, but with some radiology touches here and there, because the RCR, the Royal Radiologists, they are having some guidelines for example, code equine. When would we? This is the only exception we can do MRI spine out of hour, for example, something like that. You will not know them. You have to read out. Okay. So in B3, they will tell you, give us from your portfolio from your experience that you have been in teamwork situation. What was your role? So you have to prepare things for the responses for that, and you got to make it smart and smarter with the time. Okay. So B3 is about like teamwork. So let's have some exercise, because this is the only thing that will tell you how would you score high. Is there anyone want to volunteer? Would be very simple question. And you choose. Oh, we have hands up here. That's very good. Let me see. Dr. Krishna and Dr. Dia. So, Dr. Krishna, would you mind if I ask you a very simple question and you give an answer?
Yes.
Okay, so I'll give you a very simple question. From the questions that are there, because the point is not to test, the point is. So tell me, Dr. Krishna, give me an example from your experience of a teamwork and what was your role? What role did you play? Question 3.
So one example that I remember from my surgical rotation job when I was a surgical SHO in a transplant ward, I was called by the healthcare staff to see a post-operative patient for a clinical concern. When I went to see the patient, the concern was she had a wound dehiscence with exposed bowels. I immediately realized that this is a patient safety issue and requires prioritization and appropriate delegation. So, firstly, I asked the nurse who was in the next bay to attend the patient immediately and do some observations. And I started doing my A to E examination using the secret support protocol. Once I completed my assessment, I realized that the patient was clinically safe. However, they have a problem that needs urgent resolution. So what I did was I treated the patient using the sepsis 6 protocol, inserted a white bore cannula, sent some blood urgently to the lab, including group NSA, and contacted my surgical registrar and consultant who were working in the theater. While this was happening, I also contacted the anesthetist on call and informed them that there might be a potential case for theater. My registrar contacted me back and advised me to put some saline soap gauze immediately on the wound, which I have done, and then I waited for the team. The consultant came down within 15 minutes, examined the patient, and has decided that the patient would require theater the same day. And the patient went on to have her wound closure later during the day and successfully had a good outcome. We had a debrief at the end of the day, and the nurse said that my delegation, my ability to prioritize clinical tasks, they were efficient. However, I did not speak adequately with the patient and ensure that she was less anxious. So this is something I have taken into account, and this is something that I have been using in my practice. Moving forward, I understand that in radiology, there will be a lot of team working, especially with radiographers, secretaries, porters, and outside the department with various clinical teams. So I would like to use my team working skills learned from surgery into my practice as a radiology trainee.
Thank you so much for this answer. Thank you so much. It's almost like an ideal answer. Thank you so much. So you spent like 2.5 minutes. That's very good. So in this answer, I will give you, to be honest, very, very high marks. But is there a way to make it even higher? Yes. And I think this is, can we take another example? If someone wants to volunteer, Dr. Dia, do you want to volunteer?
Yeah, sure.
So let me ask you a very simple question. You can use the question if you want.
Yeah, I don't mind. Yeah. Shall I start?
Yes.
Okay, so working in cardiology, we often encounter patients who have cardiac arrest. So the buzzer went off on one of the days during working cardiology, and I arrived to the bedside. It was a patient who was in VF arrest, and I found a number of my colleagues who were already there. However, I quickly noticed that nobody was communicating with each other, and there was no structure for a team. Someone was already doing chest compressions, but other than that, I couldn't see any meaningful efforts. So I quickly led the team. I communicated clearly with my colleagues that I'm going to lead the cardiac arrest. And then I quickly assigned my colleagues to their roles according to ALS training. So thankfully, within only one cycle and one shock, we managed to achieve a return of spontaneous circulation. Um, this was only possible because we worked as a team and we communicated effectively. When we had a team structure, and we also acted within our training, which is advanced life support. Also, after we have achieved this, we did a debrief. We called the seniors and we did a debrief, and we learned from our mistakes. We discussed what went right, what went wrong, and we learned from our mistakes from that day. I think this shows me that as someone who can work under clinical pressure, someone who can think quickly and also communicate effectively and clearly under stressful situations. And also, I listened to the debrief, and we learned all from the what could have been better, which makes me learn from my mistakes and continuously improve myself. And I think all of these qualities are important as a radiology trainee and as a future radiologist.
Thank you so much. It's exactly like 2 minutes for 40 seconds. That's very good. So they are very, very good examples. But is there an area for improvement? I would say yes, very little area, because the answer was very, very good, to be honest. And let's say the area of improvement is different from Dr. Krishna and Dr. Dia. Okay. If I'm going to add something, I might say for Dr. Krishna first, what did he do? He gave an example that he learned and he practiced. Very good. So, first of all, he mentioned something he did. That's very important. What does that mean? That means you can't mention something generic. So you can't say, for example, team, when they are working in a big team in A&E, something might go wrong. So the registrar need to don't make it like this. Make something you have done. This is the first take-home message. Please don't forget that. If you are giving an answer, the answer must be yours. I'm telling you, this is a very senior input. This is how do they score you. You have to remember that. First of all, let's go back to the presentation. So, no, let me. So, first of all, you have to do answer use. I have done, I've seen, it was something. Don't make it vague, don't make it generic. It is your answer. And this has been ticked by Dr. Krishna and Dr. Dia. Very good. Number two, he mentioned after managing the situation, however, he mentioned that, and this is very important in radiology. This is the thing that is not, let's say, very clearly, explicitly mentioned in Dr. Dia answer. So what does that mean? This is an advantage. If you are mentioning an answer, the question was about teamwork in E&E, teamwork. Should it be medical? No. Could be teamwork in volunteer camping, whatever. Believe me, can be whenever, wherever. So doing the answer of the event of the teamwork, that's fine. That's a tick box. It meant to be yours. Number two, you must let them know this is something related to radiology. You might say it was like about, for example, doing some social gathering. There's nothing to do with the radiology. No, this is, here the skill comes. You need to say, okay, and learning this, I really felt this is something very valuable and applicable in radiology. During my tester placement, that's the thing that Dr. Krishna maybe did, I would say 70%. So reflecting back into radiology meant to be very smart and blended. You should not make it like very contrasted. Like you stopped your sentence, then you said in the radiology. For me, it looks like somehow nice, but maybe you are just trying to push it to get the mark, to tick the box. They will not give you the mark, I'm telling you. So you need to make it very smart. You need to blend it. So you can't, if someone is following your ideas, he can't say, oh, this is the transition point. You stopped and you just jumped into a new topic. How would I make it? I would say, after debriefing and things like that. And to be honest, during my, I would say, to be honest, or I would say, I'm thinking with myself, make it very natural. Thinking with myself during my test placement, I felt this is being applicable in radiology every day. I see the ST1 is speaking to the senior radiologist, senior registrar during the duty session, how to, something like that. More than that, I went to the real meeting, make it very natural. So they will give you all boxes, I'm telling you. So I like the Turkish answer, but I might refine that by trying to make it more natural no transition zone, no like from this to this, blender. And this skill will come with the practice, of course. So the tick boxes here, let's go into this. This is very important. This is the senior input here. So you have to give a marking-oriented answer. Your answer should tick all boxes. There are no like matrix or boxes to tick like anesthesia interview, because I've done both. It's not like this. The answer will get the maximum marks when you follow step number 2. So every single question in this interview, apart from portfolio question, and apart from prioritization question, they are different. So question A, 2 and 3, and B, 2 and 3, 4 questions, you have to apply the same mentality. You have, look at this ladder. You have to give a structurally smart answer. So you should not give an answer that is off point. We're talking about teamwork. You cannot give an answer about, for example, patient safety. You can involve patient safety in the middle, but it is about teamwork. You have to understand the question. Give us about teamwork and your role. This is the same question. So you have to understand. So the smart should be structurally smart. How would I approach this point? By rehearsing your answer, by making the answer. For every single question, you have to have your own answer. Write it down or learn it and do it again and again. This is the way to go into the first step in the ladder. So you are now taking the first box. The second box, to make it very individualized. I like Dr. Dia and Dr. Krishna because they did not spoke generically. You might do that in the SJT question, by the way. They will tell you, what would you do if someone, it might be very tricky. The question is coping under pressure. What would you do if someone criticized your dress code? You should not say, generally speaking, we have to respect each other. And he says, no, don't make it like this. Give an individual answer about yourself. I've been in similar position before, similar situation before. Someone told me something like that. For me, I might be feeling like upset initially, but I thought something, make it about you. If you are giving generic answer, that means anyone could say the same. Make it something that you are the only one who could say it. Something that happened to you. Believe me, this is very tricky. Number one, you have to structure your answer. This is by writing, by reading the literature, reading books, doing courses. So you have the structure of the answer. Number two, you make it very individualized. Number three, you blend into radiology. Believe me, everything could be reflected into radiology. Between 2 and 3, you might mention, when I was thinking back and I was doing reflection, because this by itself, very nice. You have to show that you are very junior. You might be registrar in other specialty, but now you are applying for ST1 role. You are a junior radiologist to be. So you have to understand that. So you have to show that you are a reflective doctor. You are doing reflection, but don't make it very fake. Don't say, have a warm phrase. Oh, I did a reflection and it was, they will not give you the mark, because the mark is not for ticking the box. The mark is for making the answer structured, smart, and radiology related, not just mentioning I did a reflection they will give you. No, you have to make it very real reflection. How I would make it very real? By saying, and noticing in my test placement, noticing that encounter could happen every day, because something like make it very real, and the reflection is coming from your heart, not just tick the box. I will do reflection. Believe me, they will not give you the mark. The last thing is, this skill comes with time. With time, you have to do it in 2 to 3 minutes. Okay, as we agreed. These 4 questions. We are not talking about prioritization. We're not talking about portfolio. They are different special case. But these other 4 questions, because they carry 40 marks of your interview. So these 4 questions, you got to follow the same. Structurally smart, individualized, radiology related in 2 to 3 minutes. Okay. So the clinical question approach, which is the prioritization / trauma report. This question, as we agreed, they are carrying 20 marks times 2. What do I need to prioritize the question? They will give you 5 patients. How can you prioritize them? You have to look for the urgency. If the thing is urgent, for example, testicular torsion, PE, stroke, they are very urgent things. Or, for example, they might be very tricky. 2-week wait of cancer. This is urgent, but not as urgent as these cases. Patient is not going to die from cancer. This needs to be done within 2 weeks. So this not like as urgent as the previous ones. Be very mindful. Or they might tell you, okay, this is like a mapping scan or scan pre-op. So the patient is for operation, we know everything, and this scan just to help the surgeon in the theater. This is not an urgent. This could be done tomorrow. So you have to mind the urgency of the case, number one. Is that enough? No, because I gave so many urgent things. Stroke, PE, aortic dissection, testicular torsion, and for example, intestinal obstruction. I need someone to volunteer to tell me which one of these five would not be prioritized. They are all urgent, but one of them would not be prioritized. Let me look. Who is raising hand? Dr. Arun. One of these five is not priority. Which one?
Hi, Qusai. So
Hi.
I will go according to ABCD approach, which I learned from ALS. So whichever compromising airway breathing first, so I will go with that. So I believe P is the most important here.
Which one?
So can you kindly again
I,
give
I
me the
have five
question?
patients. I need you just to pick me which one of them is not priority, despite they are very
Okay.
urgent. Number one, aortic dissection. Number two, PE. Number three, stroke. Number four, uh, testicular torsion. Number five, intestinal obstruction. One of them is not urgent. It is urgent, but it's not urgent.
Okay.
What do you think? If you want some help from Dr. Riham and Surah, that's fine.
Yeah, I will take it.
Anyone want to help? One of
I
these is not going to be prioritized.
I will go with CTP.
No, no.
CTP
Who's the one that we are not prioritizing?
CTP
One
will
of
not
these-
just prioritize.
Yeah.
That can be done later if there is no clinical urgency.
Which one?
CTP for the kidney.
CTPA. Okay, okay, that's very good. Anyone has a different view?
I would say
If it's related to clinical urgency, you can say testicular torsion because you would
Very good.
essentially call the surgeons and say,
This is the
do the
answer that I want.
surgery.
Look at this ladder. I kept this figure for a reason here. Look at this. Look at number two. How impactful the scan would be. Now I have a testicular torsion. Do we need a scan for that? The scan is not going to change anything. If it is testicular torsion, this is like clinical diagnosis. The scan, ultrasound or CT or whatever, is very, very inappropriate here because why I would waste time and waste patient tissue, the time of the scan, and this tissue is going to die if we could manage that clinically, because testicular torsion is a clinical diagnosis. If clinically the surgeon or the urologist thinking about this should take the patient to theater immediately to detorsion, isn't it? So it's not just the urgency. I need you to be very mindful. Yes, the urgency number one, but you have a different filter. Is the scan really needed, necessary, going to change anything? Some diagnoses are clinical, like testicular torsion. So the scan might follow later, but this is not the urgent, this is not the most important step. But in stroke, no. We need to do scan. Is it hemorrhagic? Is it embolic? No, we need scan. CT PA, we need scan. Something like that. So for CTPA, that's a very good answer, by the way. Why? Because the patient might be dynamically unstable. He is not stable to go to big scan like CTPA or CT aortogram. If it is aortic dissection, we need to stabilize him first. I agree with that. So look if the scan, if the case is urgent or not. And number two, the filter number two, if the scan is going to change anything. Number three, the appropriateness of the request and the timing. This is very important. This is applicable for the doctor's answer. Now, it is like aortic dissection. We know CT aortogram is the diagnosis of gold standard. But if is the patient appropriate to get that scan? He might be vitally unstable. We need to stabilize him. We need to take him somewhere to get some fluid, for example. So you have to mind all of these things. Again, this is very thorough when it comes to CTPA, CT aortogram, these things. You have to think many times. Okay, you have to mention that. Or keep it number three when you start with, for example, stroke, trauma, then you come to the CTPA, you have to mention. I kept it number three because I would like to ask, is there any, was there any blood thinner has been given? They need to give. Is the patient pregnant? any pregnancy test, because we all know if the patient is pregnant and she's in childbearing age, this is very much, you have to be mindful. Or is it VQ scan or CTPA? You have to discuss this. So it's very thorough. It's very tricky area. That's why it's 9 minutes, 7 minutes. You have to discuss. If you are just giving the right answer without discussing, they'll give you 0. You have to discuss it. You have to take them through. You have to show them how competent you are as an SHO. So the urgency of the scan, of the case, is very important. How impactful the scan would be. The scan might change nothing. So you don't need scan now. Especially when they are telling you you are out of hour. It is like bank holiday, something like that. Number 3, the appropriateness. The scan might not be appropriate. For example, they might ask you very severe headache and MRI. Is the MRI the scan of the headache? No, you have to do CT scan first. MRI could be done like outpatient thing in 2-3 weeks, no problem. But it is not like an urgent thing now. Migraine, for example. Is the scan appropriate? So please remember this. The urgency of the case, impactful, and the impact of the scan, and the appropriateness, the timing and request. The patient might not be stable enough to go on the table. So you have to be very mindful of these things. So for the 4 questions, A, 2, and 3, B, 2, and 3, you have to make the answer smart, individualized, and radiology related. Don't forget that. This is very important. You score very high and blend them. Don't make don't tell the examiner, I'm acting, I'm faking the answer, I'm just ticking boxes. They will not give you, because it's not tick box matrix. It's not like that. It's descriptor. So with practice, you will know how to do that. Again, what I was saying, there is an important point. I don't know if I mentioned that or not. Again, there is something here. I think I missed to put in the slide. You will, with practice, I will come into it. So with practice, okay. So yes, this is very important as well. The last yearly before, as a group and other colleagues, there was something that worked for one of my colleagues. What was it? Now we know the structure of the interview. We know exactly what are we being challenged or asked or tested in station A1, A2, A3. We know that. So, and we have 5 days. Believe me, this is very important. 5 days of interview. Let's say, for example, I booked my interview in the first day. Is that going to change anything? Yes. So, believe it or not, they are going to ask the most classical version of that question. So let's go back here. We are in station A. Let's see station A, 2 and 3. Station A2, question about understanding the radiology and the specialty. If you are doing the exam, the interview in first day, they will ask you the most classical question. In A2, the question would be, why do you want to be a radiologist? What do you know about radiology? Something very classical. Everyone knows. But in day 5, for example, day 5 is usually kept for people applying for nuclear medicine and radiology. So let's get away from that. Let's say day 4. In day 4, for example, in the same domain, same question A2, they will ask you a very weird question. Not very weird. It's not very weird. I don't want to scare you. But the question that is less common, less classical, in the same domain. So we'll ask you, instead of asking about the curriculum or asking about why do you want to be a radiologist, they will ask you, for example, something like, tell us what do you know about how to get into radiology. You have to know, I can get into radiology from ST1 port or ST1 route or ST3 or nuclear medicine, something like that. It's not very, very weird, to be honest. It's fair, but the most classical question will be in the first days. Is that going to change your preparation? No, but you have to prepare smartly. Put more effort, more weight, according to your booking day. If you are doing the first days, do the most classical question 10, 15 times, because they are going to ask you these questions. But if you are going to do in later days, yes, know them, but they are not repeating the question. So you got to know more about the same domain, more questions, to do more readings. Is that going to change drastically? Not really, But when you know that information, you feel more confident, you feel more comfortable. That's why we need to alleviate that anxiety. Because I know I've been in that situation. You will be so anxious now. So you good to know more, to relax more, to do better, to be the best of yourself. Okay. So what resources do we have? First of all, you have to have some webinars like this, question banks or courses. Why? To know the structure. So every answer will have three like axes. Number one, the structure should be smart. Number two, it should be individualized. Number three, it should be radiology related. You have to link it to radiology. So how would we know the structure itself? Because questions are so many. By doing these webinars, by doing these question banks, by doing these courses. Do I recommend some of them? Yes. Radcast course is very good. Radiology interview course, very good. They have a very good book, and it's been scanned and it's available online for free. So you can read that book. It will give you an answers for every single stations, apart from the prioritization, because they were new. So they will answer 5 of your 6 questions. They're very good. UKRC, they have very good mocks. You got to do them because I'm telling you why you need mocks. And there is a course called London Radiology course. They have very good material as well. And there is a question bank online called Radiology Interview Prep. I've seen it. It's really good. And it's cheap. You can share with your colleague or something like that. So these are, you don't need all of them, maybe 1 or 2 maximum. And if you are a group, as you see step number 2, practice as group. Don't practice alone, please. Practice as a group. 4, 5 members at maximum. So maybe as a group 5, you might subscribe into 2 courses, 1 question bank, 1 course, and share it between yourself. That would be fine. Number 3, if you are in the UK, you might do like trust level group. So go to your ST1 radiologist, radiology registrar, ST2, ST3, and ask them to do you a mock or something like that. That would be very useful as well. There are online mocks. I really recommend them. As I told you, you got to do 1-2 mocks. Radcast, they have mocks, radiology interview course, UKRC. They are very good mocks. You got to do them, and they are very useful because you will not know your weaknesses otherwise. So let me tell you, why do you need step 1? To know the context of your answer. This is why number 1. That's very clear. Why do you need number 2? Why do you need to practice in group? I might practice alone with a mirror or something. No. Why? Because believe me, this is something very tricky. No one will tell you about that. They will count your body language. For example, me myself, this is my personality. I'm very energetic. I talk more. I use my hands. This is very positive. They need to hire a very excited ST1. Not stupidly excited, but very excited in a professional manner. So when you are talking, you have your tone should be going up and down. You should not be like monotonic and very relaxed. They are not going to pick you because they have 700 candidates. They can choose. They can pick and choose. So you got to tell them, I'm very excited. I'm ST1 who is having very energetic level of talking and things like that. So you got to use a lot of hand language, body language, gestures, things like that. I used to do that when I'm talking. So that went well for me, and I'm showing you in a minute. So how would you know that? By practicing with your colleague. Other reason for you to do number 2, time management. With yourself, you might set a timer, that's fine. But when you face the people, believe me, it's not the same. So you need to practice with a group for 2 reasons. To manage your time. Again, we've learned 2 to 3 minutes. And to acquire this body language. So what I used to try to tell my colleagues, the secret behind this interview preparation is you need to act like you are not acting. You understand what I'm saying? So you are doing things naturally. When you are trying to touch radiology related things, blend into radiology, try to reflect back, you do it very naturally. Like, oh, you just remember something like that. So you're acting like you are not acting. This skill will never be there unless you are practicing. And you practice with the people. They will tell you, you've been monotonic here, you've been less energetic. So they will give you that feedback. So you have to acquire this. That's why number 2. Why number 3? Because it's free, something from expert, and it's nice to get like more feedback, more inputs from people who went through the same and they've done it. Why number 4? If I'm practicing in group and I have the resources and I spoke with my hospital registrars, why do I need online mocks? Why would I pay more money for that? Anyone would tell me why? Because you might do mocks with your with number two, with your colleagues, with your group of practice. You might do mocks between each other. Why do you need online mocks with someone else? Any thoughts about that?
Because you get professional views.
Very good. This is number one. I agree with that 100%. This is the first reason I like that. Number two, because when you are doing number two quite a while for 2-3 weeks, I know you don't have that, but I'm just generally speaking, you will get used to them, so you don't feel that anxiety anymore. You might be doing the practice while you are drinking coffee or having breakfast. I've done that before, so you feel very relaxed with them. You need a third party whom you don't know. You are very anxious against them, so you are mimicking the real interview situation. Because believe me, if you're practicing for a long time now with the same group, when you suddenly meet the interviewers, you will have that panicking. Your heart will be racing like crazy. You don't want to go through that. You want to go through that gradually. You are ready for everything, believe me. As I told you, this is like a mental game. So practice with the group, right, left, and center all the time. That's absolutely fine. But have that online mock. Have that sense of anxiety. Have that sense of, oh, they are strangers to me. I don't know them. I got to dress well. I got to be professional. I got to treat that like a real interview. Because when you are doing a lot of number two, you will get relaxed. Believe me. This is like a normal human being. You will get adapted to that. So we need to overcome this. So number two is very important to acquire two things: the body language, hand language, and time management. Number one, for the texture of the answers, you've got to personalize them. You know that. Number three, because it's free, extra input. Why not? If you are dismissing number three, there is no harm. Number four is very important to get that sense again every now and then. 2 mocks will be enough. 1 mock will be enough. But you have to have mock. Treat it very, very seriously. Dress well and dress professionally. Make like you are doing it. Don't take it easy, please. The people who are taking this easy, they are going to lose something without they are knowing that. You got to do it by religiously. So you are living the full experience of the interview. So I'm giving you like some hope now. I've gone through the interview twice. So the first time I passed the interview, but my portfolio was very, very low, so I didn't get an offer. So in station one, there were 2 stations, so A and B. Station A was the clinical prioritization scenario and understanding of specialty. So in understanding of specialty, the 2 panelists, they gave me 5 and 5, so my score was 10. That's fine. In the clinical scenario, one gave me 4 and the other gave me 4, so my score was 8. So I scored 8, and as I told you, they will multiply that by 2. So it's 16 out of 20, and 16 plus 10, that's 26 out of 30, which is very good. In station 3, we have 3 questions. I want you to look on the feedback. I don't know if you can. Can you see the feedback? So the panelist number 1 told me, well explained. So they asked me something about coping with pressure and managing uncertainty. It was like an SKT scenario. So the panelist number 1, he said, well explained, slightly lack depth. Look at this comment. Please mind this. What does that mean? So I gave like good answer because at that time I studied SKT very well. Not very well, let's say well. So I gave an answer. So lack the depth. It wasn't very deep answer. I need to speak about myself. Look at these comments. So they are not telling you, did not tick the box of personal. They are not going to tell you that. Panelist number 2, he said, well-rounded answer. Gave me 4. In the other station, team involvement, panelist number 1, again, he said, good understanding of concepts, because it was like about, again, SKT. So I explained the concept and teamwork and data of kind of things like that. Panelist number 2, he said, slightly went off track with the question initially, because again, I explained the concept too much because I thought, oh, this is something that I know. Let me explain initially. But with they prompted me, ended with a good answer. He gave me 3. This is telling everything that you want. You need to give a personal answer, very smart, not off point. They are going to prompt you, but this is will be inexpensive for your marks. So you got to know your answer very well. You have to understand the question. Don't give off point answer. And don't explain about the concept too much. Make it about yourself, about the question. The question is not explain to us the concept of teamwork. No, tell us a situation. So that was the question. Again, the third question is about the skill. Again, they gave me 4 and 3, 7 as well. So the panelists say reasonable answer, but needed to relate to non-technical. Oh my goodness, look at this. I lacked the fact that I need to relate this to non-technical skills, to personal achievement. What does that mean? The question was clearly about non-technical skills of radiologists. Non-technical skills, because radiologists, they have technical skills to be a radiologist, and non-technical, that's generic skills. You'll find that in the personal specification. Like, for example, teamwork, coping and everything, things that generic, good communication with colleagues. So I made it, but I did not attach it to myself. That's why they gave me 3 and 4. If I attached it to myself by saying, okay, this, and the first moment that I thought I could apply this, when I, for example, make it very natural. When I, during my test replacement in tertiary hospital, I thought that, so make it something that you have done, achievement. Very personalized, I'll give you 5 out of 5. So I thought I've done better than this because I gave nothing was out of my depth and breadth, but 47 is a good answer, is a good score, but if you are doing very less in portfolio, you have to score higher than this. So I got an offer the first year. The second year, I learned the skill. I learned what they are asking me for. So look at the comments. I'm just focusing on the comments. So again, clinical scenario prioritization, it's 10 out of 10. Multiply that by 2, it's 20. In that station A1, panelist 1 said, understands urgency of pneumothorax. One of the questions was about chest pain sharp on one side after procedure or something. So I said the most probable diagnosis is pneumothorax, one of the differential diagnosis of cardiac arrest. I mentioned something like that. You have to look smart. So they say, he said, understand that about me, the urgency of pneumothorax. That's very urgent. Select patient number 2, next. And understand, I don't remember what was the patient number 2. Understand clinical urgency and usefulness of ultrasound. Okay. Oh, I think it was like aortic dissection. I'm not really sure. So when I was going through the options, I say, first, I will start with the pneumothorax because this could kill patient in seconds. Number 2, I'll pick the patient of, I think it was, I'm not really sure, like a dissection or something. And they asked for something, for example, CT scan. Why not ultrasound? The patient is urgent, but the scan was not appropriate. Why not ultrasound? For example, I'm not really sure, but I think it was something around that. So he mentioned that, oh, this candidate, understand what he's saying. And he said, then select patient number 3 next. The panelist number 3, he said, good prioritization, clear line between the role. This is very, very tricky. What does that mean? Sometimes you might go further and act like you are the surgeon. And we are going to take him to theater. We are going to do NG-tube. This is not your job. You have to understand you are very good radiologist, not very good everything. That's why at one point I said, from now on, it will be under the clinical team responsibility. I will be following if they ask something like that. You have to make it very clear. So again, prioritization question is understanding the urgency, the appropriateness or the impact of the scan, the appropriateness, and your role. I kept it number 4 because there will be too much. I kept it for this slide. You have to remember, you will never forget this comment, I know. And you will thank me later. One of the panelists said, I gave him 5 out of 5 because he is understanding the lines between the roles. If you are a radiologist, you are not expected to do the role of the surgeon or to speak about the role of the urologist, put a conduit. This is not your role. You don't speak about that. That's why they're giving you more marks. You have to understand that. Okay, the other question, one panelist gave me 4, the other gave me 5. So panelists who gave me 4 say, done 2 tests a week. So it was about understanding the specialty. So I told him, I don't remember the exact question, but I mentioned about I've done tests a week, and that's why I understood this. So you need to make it very, very personalized and something you have done from your portfolio. So he mentioned that. He mentioned, I've done 2 tests a week, one in DGH, one in tertiary hospital, stated that lack of patient interaction might be least attractive part of radiology. So I don't remember the exact question, but they gave me something like that. I didn't answer the question directly. I said the best moment that I felt I could So I made it very natural when I've done my test placement in the going for my other test plan. I realized the difference. So I made it something like that. I don't remember the exact question. However, he mentioned that he did, but I don't know why he gave me 4. So he said he did this, he did this. He mentioned me. The least attractive is maybe patient lack of patience, something like that. So give me 4. The other panelists, he said excellent radiology knowledge and experience. Give me 5. So in this station, out of 30, I got 10 times 2, which is 20, then 9, 90, 29 out of 30. Okay, this in station 1. Station 2, I got 10, 10, 10. So my final marks was 59 out of 60. As I told you, my portfolio was below average, was very low for the people who are competing in radiology who already passed the MSRA. I was one of the lowest, but I scored very good in the interview because I knew I need to. Otherwise, I'm not securing an offer. If you are doing very well in the portfolio, you are having a better chance to score. So let your aim be top 1%, top 2%, why not? So let's go for the feedbacks. Station 2, station A1, the question was coping under pressure and managing uncertainty. So the panelists say he provided good direct example. Look at this comment. Good and direct example that I have done of process involved. So something I've been involved to. He liked that. The other parents say I did seek information, sensitive approach, patience. He did very detailed feedback, seek information, sensitive approach, patient safety, respect colleague, reflect on. Look at this sequence. You got to do the thing that they're asking. It is an SKT thing. So you have to seek information, SPI, science, SPI, these things, sensitive approach. I mentioned all of these things. It's an SKT. Something that you definitely know. Plus, I did the reflection in a very smart way. Respect colleague. Something like that. So he gave me 5 out of 5. The other question was about team involvement. The first panel said, good example. So you need to make a good example. You need to learn the answer. You need to prepare an answer for that, to make up an answer, to be honest. And team player, because the question was about the team and yourself. So you have to add your own self. That was the good thing about Dr. Dia and Dr. Krishna question. Answer, sorry. So panelist number 2, he said, okay, he taught an F1 doctor to cannulate. Oh, the question was, so my answer was, the question was, tell us about the team was underperforming one of your colleague. So came up with the answer, very nice. One of my colleagues, he's F1, he did not have his medical training here. He came in A&E and he needed to do cannula every day. He was not that confident. So this might pose and I made it like a story. Made it very natural. I've asked him, what do you think the worst thing could happen? He said patient safety. So I like he has insight. I mentioned that. So they tick that box. And I told him, so for patient safety, I spoke to my F1. What do you think we should do? He said, I might speak to my supervisor. So I knew he is going to be a safe doctor. And I did not make it very confrontational. I made it like we are just discussing in a very private, non-confrontational. The thing that I have learned in SKT, I just applied that verbally here. So they gave me full marks. Question 3, the question was about skills. So the panelist number 1 say he had good insight into profession and understanding what is involved. So this is purely personal specification. You have to know them. You have to AI them and make them smarter so you can swallow them and make them like in phrases. Panelist number 2 say demonstrate good performance with exam success and work. Oh, okay, yes. So one of the skills was to be good in evidence-based medicine and to be. So I think I'm high achiever in terms of exams, and I've mentioned exams that is not applicable in the UK, somewhere else. So I passed this exam, not just like that. Even if in MSRA nationally, I scored top. So you got to mention them. Don't be shy. This is something we're going to give you marks. So mention this in context of radiology. So I know in radiology I need to do a lot of learning. I've gone through the RCR website and I knew the pass rate of, for example, part 1 was difficult. So that's a good thing that I'm already an academic person. Some link things to things. So they will give you full marks. Last thing, your clear preparation timeline. You have 1 week or so, what you should do. Number 1, you have the orientation now. You know why you're up to. You know the minimum you should achieve. You know them. You know, if you are scoring this bit in portfolio, you need to score this bit in interview. No surprises. This is like an open game for you. You know everything now. This will relieve a lot of your tension. Number two, you know your the target practice. You got to utilize these resources, the webinars, the question bank, these things to practice daily. Why? To acquire the body language, to be very energetic when you're talking, and to have the time management. This is the whole point of you practicing every day. You might practice just with yourself or camera or mirror, but no, practice with the people for the body language and for the time management. And you have to take realistic mocks. Why? To simulate the exam conditions. Again, why? To overcome the adaptation factor. Because when you are doing practice with the same people, you will adapt to them. You will become like friends. Now you are not afraid of them anymore, if that's the right word. You got to do mocks with some people that you don't know, they're very professional. It's just about you being under stress, to test yourself under stress. That's very important. Final points. You are a great candidate. You have to know that. You made it through the most difficult step of very competitive process. And the competition ratio is 2-1. For you, I believe, is maybe 1.2 to 1. You are in an upper leg now because you are more oriented. You know more. You are less stressed. You know your target. So you know more, you are less stressed. Now, don't forget, orientation is the key. And it's the time for teamwork. Do you need to know people before you practice with them? The answer is definitely not. I practiced with the people that they were brand new for me, and we made the best group of practice, and we all got the first or second preference of our radiology offers. So you don't need to know them. You just need to practice. Again, don't make the group very, very big. Big group, big units, they will just lag. So you need 4 or 5 maximum. Practice I wouldn't say every day because it's just 7 days. Keep like 4 hours of practice a day. I know it's very difficult, but and don't forget to take time off for your interview, please. Thank you for attending. And if you have any questions, I'll be happy to take them. We have maybe like you're overstaying as usual, no problem. Any more questions? No question? Yes. So I will take Dr. Marwa, Dr. Mess, and Dr. Sura. Yes, Dr. Marwa.
So, Dr. Qusai, about that question, like give us an example from your portfolio about this or that. Does it have to be like from the 5 domains that we have uploaded evidence
Not at
of,
all.
or
Not
it can
at all.
be anything, like any case that I have seen?
Yes, that's correct. From your experience. If from portfolio, that would not be applicable because they might ask you anything, and portfolio is just 5 domains, so it doesn't make sense. From portfolio means portfolio as an English word means your experience, the thing that you've done, not the uploaded portfolio.
I got a question on the portfolio.
Okay, yes, Doctor number 2. Yes, go ahead. Go ahead, please.
In regards to using examples, can you use the same example for more than one time? So, for example, let's say if you have a QIP.
You have to be very smart. You can use the same example in 2 different stations because the people are different, but you can't use with the same person. You will look like you are less smart. I'm not, I'm not talking to you. I'm talking generally. People are giving different examples, and you are the only one who's giving the same example with the same person. It's not smart enough. But you can be very smart. Use the same like achievement in 2 different stations because I'm telling you, thankfully, they are different people. The people that are interviewing you in station A, they are different from station B. You can use it perfectly. And a lot of people, they've done that, by the way. I know a candidate who got a very high rank, they've done that. But not with the same panelist. So you need to. And by the way, you got to be smart. You reminded me of something nice. If the achievement was very, very old, you got to bring something fresher. Why? Because you are telling the examiner, oh, I'm like outdated. I have done nothing in 10 years. I'm not the best ST1. I'm not very excited, My only achievement that I've mentioned was 10 years ago. It's not the best. It might work, it might not. So why are you putting yourself down? So again, as I told you, you are learning answer and you are writing answer. So write something recent, write something different. You can use the same thing for different questions if they are in different stations. Yes.
Thank you.
No worries. Yes, Dr. Sura, then Ritu.
Thank you, Dr. Qusai, for this insightful talk. I just have a question about the technical skills, like specifically what should we mention about radiologists? Like, is it like attention to detail? Is there any specific skills that make it technical?
Yes, you have different non-technical or generic and different technical. You can't mix them. If they are asking about technical, mention the technical. Are there any specific skills you need to mention? No, because there are 6 or 7. As I told you, I mentioned something very sensitive and very smart. You can AI them. Believe me, that's very useful source and make them personalized to you. So whatever you like and whatever you think you have more strong points toward, for example, I have more strong point toward attention to details. Why? Because, for example, I would say you might find that very funny, but you might say, okay, I'm very good at playing Sudoku or chess, for example. You might bring that into the context. You might say, I've done this competition. I came first, for example, in this game. So I thought this is really paying much attention to details. That's why when I've done my test a week, I thought the radiologists, even the junior of them, they look into the scan in different. So you can make use of anything in your life. So if you think this exact skill is more applicable to yourself, pick this up. Because you'll have like 6 or 7, you got to choose 2 or 3 of them maximum because you have 3 minutes only. So from, let's say, the technical skills in radiology, they are 8. You got to choose 2 or 3. They are most relevant to yourself. You can reflect back to your portfolio and to tester placement and do them. Are there any preferable skills over? No. Just choose the most relevant to your portfolio that you can make a better answer of.
Thank you.
No worries. Yes, Dr. Rito?
Hi. First of all, thank you so much for this talk. It was really useful. I had a quick question. So we've been told that at the end of the interview, there'll be an opportunity to talk. They'll ask you if there's anything else you want to add. And it's been suggested that we should talk about our greatest achievement from our portfolio. But I was just wondering on how you would approach this question, and what would you say if you had lots of good things in your portfolio, but nothing that would say particularly stand out compared to other candidates?
I'm telling you what I have done myself. I had that like, it was like 52 seconds. So they've asked me, I can tell they were very impressed with my answer. So they asked me, you have now 50 seconds. Do you want to add anything? I've added one thing. There is no limitation to the speak or the ideas you can tell. If you want to speak about your achievement, that's fine. What I've done myself, I said, to be honest, I will be very, very, very proud to be like a future ST1 or ST1 to be, because I believe radiologists are very great people. And the reason for me to say that, when I went through this process, a lot of my hospital ST1 radiologists, they volunteer to help me and they arrange free mocks and things without me asking. So to be a good radiologist, you need to be a good human being and you need to help people. And I love to help people like professionals. Something is not even relevant to the interview. They like this so much. So in this 1 minute, you just need to look smart. So they will like it, they will add you more marks. You can be looking smart by mentioning something nice in your portfolio in a nice way. Yes, that's fine. And you can speak off point. I'm talking about off point in terms of achievement and things like that. And can you look smart? So they like this so much. So what I'm trying to say, there is no limitation. You can't speak about your, it's not like you should follow this. No. You can be looking very smart by speaking about one of your achievements in a very different way. Yes, but this will happen if you practice too much and it became like a second nature. You're speaking spontaneously, you are using your hands, you are relaxed. So whatever you say will look smart. So that's the whole point. Just you need to look smart. It could be like an achievement, that's fine. That's even easier because that's something objective. It could be something very nice talk. They might like it. So I thought every other one will speak about achievement and things like that. How would they remember me? I need to tell something different, something like touching them themselves. They've been working from 8 to 6. I think they are free. They're working for free. So let's give them something nice. So something like that. That would work. So anything would work. Just try to look smart. This will happen by you practicing so much, and you reach that point, being relaxed. Whatever they will ask you, you are not anxious. You can just blend answers into radiology. Whatever you will say will look smart. Could be achievement, could be encounter, it could be like For example, I've been inspired by one radiologist. I've seen one video for it, something like that. I thought I need to be like this man. So something like that.
Perfect. Thank you so much.
No worries. Yes, Dr. Muhammad Zain.
Yeah, my question is about station A. You said that they will take 10 minutes to review my portfolio, and I will be in lobby at that time. And the total time with the station is 15 minutes. So would I be having just 5 minutes to answer all the questions?
Okay, for station A, before you start station A, they will have you waiting for 10 minutes while they are reviewing the portfolio. That's correct. Then he will start asking you 2 questions around your portfolio. We agreed we need to finish these answers in 8 minutes, something like that. Then they will move into question 2, then 3. If you overstay 10 minutes, 15 minutes, they will not going to stop you. You're just eating your own time. Between 2 stations, they will give you some time for break because they are different people. You will get off that link, and I think, I don't exactly remember, but you will join again, and you will have some break in between. Not just like that. Before question 1 in station B, which is the prioritization question, they will tell you, now you will have 1 minute. Read the question, read, and make notes. And then after 1 minute, they will ask you, talk us through. Then we'll say, okay, patient 2 was blah, blah, something like that. So you will have.
So the interview will last more than 30 minutes, not just 30 minutes.
Oh, 30 minutes is the actual
Interview, but the
It's definitely more
technicality
than
and
that.
everything else, like the 10 minutes
Definitely
before
more
and
than
the...
that. Correct. Correct.
Okay. Okay, thank you.
So again, please try to take some time off, please. At least if you are doing in the morning, but if you are doing the interview in the afternoon, don't work in the morning. You'll be very busy. Okay? No problem. Yes, Dr. Ahan?
Hi, thank you so much once again for this amazing talk. A lot of insightful. Yeah, so thank you. I think my question is about the portfolio actually. So you mentioned, for example, you applied with say 30 points and they gave you 27, for example. Like, how does that work? Like, do they let you know what your
Yes.
portfolio score?
They will give you a justification, and they will ask you to appeal if you want. I appealed. It was very strange story. I appealed. Then I might speak about that after we finish the record. But I did the appeal, but it didn't work for me. So they underscore me. But don't be scared of that. Some people actually, they've been overscored because when they appeal, they gave them more marks. So it could work either way. So I would strongly recommend, score yourself the maximum that you believe on, and if they underscore you, it's not the end of the world. You have now example in front of your eyes. It's been underscored by 5 mark or something, and in the first place, my portfolio was not very, very high. So when they underscored me, I felt so anxious, to be honest. But when I thought, okay, I knew what they want from me, I think I ended up 76 or something in the national rank, despite my, I would say, below average portfolio, because the bulk in the interview you can see that. So don't be too worried. If they underscore you, you can appeal. It might work. I hope they will not do that. If it didn't work, you still have 60% in your interview, and you can make it.
And when do you find out that score? Do you find that your portfolio
48 hours.
scored? Oh, 48 hours after the interview, you find out your portfolio score?
No. The portfolio, there is a window. If you go through the timeline, they will mention anything. They will mention everything. They will mention when would you close the window, when would you appeal, and within the appeal, after you appeal, you submit your appeal, 48 hours, they will respond to you.
So before going into the interview, you'll know what they've given you as a score.
I don't remember exactly, to be honest, because it was like, I don't remember. I don't want to give like a wrong answer, but the timeline is there. But I don't remember.
So
This year,
Hmm.
as one of the comments mentioned, it's very short time between the interview, the upload of the things, and the interview. So it might be during.
Yeah. One last question I had actually. I could see that you've done significantly better in the second time you attempted the interview. What was the major change you made in your preparation for the first time?
Orientation. Now I knew how would they score me, what the best answer could look like. It's not just me explaining the concept of confidentiality or talking about teamwork. No, you have to make it very personalized. You have to give them the feeling that I've gone through this, I've reflected something new, and this is, by the way, radiology related because my eyes seen this. The thing that I've been mentioning now.
Perfect. Thank you so much.
No worries. Yes, Dr. Marwa, then Riham, then Bashir.
So, Dr. Qusai, regarding the prioritization question, was it that you have done, mashallah, very well? Is it just because you had an excellent clinical background? Or I know that there are Q banks, there are webinars, but have you done any specific reading, any website that you would recommend?
Very good.
Thank you.
So I would say 75% is your clinical knowledge. Do you need deep clinical knowledge? No, because the thing that can bring is very limited, are very limited. The thing they can bring, they can't ask you for all sort of everything. So clinical knowledge is important, but you can easily bridge that up. How? By, as I told you, you have to know these tricks of RCR guidelines. When in what period of time we should do CT head for possible stroke? In how long should we take the patient into theater if it is like an MI, something like that. So RCR, they have guidelines for these things. You stress them out, you will find them, you practice them. Otherwise, your basic clinical knowledge. In PE, this is very important, but because she might be pregnant, they will mention 25-year-old lady. Oh, this child being engaged. I will ask the clinical team, the referring team, have you done any pregnancy test? Was there any like double ultrasound, things like that? You know how would you manage PE? You don't need to wait for CTPA to start the management. You have to put patient on management. Anyway, so things like that. Your let's say the clinical part of MSRA will sort that out, but you need to have the skill of practicing this every day. So you know what to say. Plus these tips and tricks of RCR related guidelines, the timing and things like that, you got to test them up. You have to know them. Because I believe I use them. I use that. Apparently, the pneumothorax scenario, you don't need anything. This is your clinical knowledge, but use them for stroke, for lumbar, for coda equina, for so many things. So you have to know what RCR are recommending as a timing and type of scan for specific conditions. For example, trauma is always number one. If they are told you there was trauma, don't think about anything else. Vet the trauma first, not just like that. Go, tell them I will do the trauma protocol, and I will go myself from my office to the scanning room, because while they are scanning, you can see in the screen live. So you give like a preliminary report. So think like that. So there are quite a few tricks, you have to know them by heart. So this, in combination with your clinical knowledge, you will score high. Plus the practice, how to put things into words and phrases and things like that. Okay, hope that makes sense. Yes, Dr. Rehan?
Right. My question is regarding the clinical practices. You said that we can make notes. We can keep this with us to make the notes. Is it allowed? And we should respond to that.
To be honest, I can't hear properly, but to the best of my hearing, I think you're asking about making notes. You can make notes in station B1, the prioritization only. Because you don't have that time. When they start the station, they will move into the next question, and you have just 3 minutes. You don't have a chance to do anything. So before the start of the prioritization, they will tell you, you have 1 minute, read and make notes. And the notes, to be honest, it shouldn't be like very thorough. It should be like the order that you are going through, and just maybe 1-2 words so you don't forget. For example, just pleuritic chest pain and pregnant lady, you might keep Doppler ultrasound, blood thinner. So few things that you need to mention in your discussion so you don't forget them. Things like that. So you can make notes in question B1. Yeah.
Okay.
Hope that makes sense. Yes, Dr. Bashir Ahmed, last question.
Hi. Thank you for the presentation as well. It's just regarding the evidence upload. I'm not sure if this is different from last year, but with the domains, they ask about one of the things is like the title of the evidence. And I mean, to be honest, I didn't write too much at that time. So if I added extra details, will they count me by negatives?
No,
I didn't.
no. But if they, for some reason, I'm not talking about you, I know all of us are professional enough. If they, for some reason, they thought, okay, this evidence was fake or something like not genuine, they will. Other than that, it is very, very acceptable and expected for you to think something and they think differently. That's why there is a review and they down mark you and then you appeal. This year, the appeal process is not like last year because now the one who is going to mark you is this is like a live process, 10 minutes to mark you. I don't know if you can appeal about that. Last year it was online. They will send you the feedback, then you appeal. But this year is different, to be honest. And we will find out after you guys going through this. So I'm not really sure how would you appeal and things like that. I'm not really sure.
Yeah. Okay. Thank you.
No worries. Yes, last question, please, Dr. Ams A.
Thank you for your time. It was just to clarify for the portfolio station, they can ask us questions about why we have ranked our evidence as certain grades or scores. Do we, when we do clarify, do we have to then still relate it back to our experiences? So, for example, I did this teaching, it's national, and this is why I scored myself B or A. And this is relevant for radiology because, or do you just tell them that this is national and this is what my experience is?
Okay, very good answer. Now, in this question, you will have like 8 to 9 minutes. That's a plenty of time, believe me. So you got to be smart. You don't link things that's irrelevant. I agree with you. But again, if they are asking you, you have to achieve 2 goals. Number 1, to justify why did you give yourself this. You have to make it very clear and smart. This. The program was containing students from everywhere, and I thought this is the best application of descriptor A and B. And make it very brief. And I think this is very reflective of the radiology practice in the UK because I understand the NHS is really multi-diverse. I'm just making up answers. Let's make it like this, multi-diverse. And during the test replacement, I thought the teaching they have done is really applicable because I thought a radiologist coming from everywhere, different national, different everything. So make it like this, why not? Don't go so deep because the question is not about your, it's not applicable to reflect on radiology too much, but make it very smart and brief. I will do it. But if I thought the only way to do it is to go deep, I will not do it because it's somehow irrelevant. If you can make it very smart and very brief, that's nice. Again, it's all about acting that you're not acting. And this skill will come with practice and with orientation first. If you practice for 100 years without you having the orientation, you're not going to reach. So have the orientation and do the practice now. And I hope you're all having like small groups to practice with because this is the only way forward. Don't make a very big group and don't practice alone, please. If you don't have more questions, this is exact 2 hours now. 7:30 to 9:30. Thank you so much for attending this.
I got one more question, sorry, just the last one.
No problem.
If you have any connection issues, I know that on the Oreo platform they test your device before the interview, but if there's any connection issues where you're logged out, are you still able to carry on with the interview, or is there any review process for this?
No one had a connection problem and been discarded, never. So keep your phone silent but on because they might ring you. They might arrange something for you within the same day or maybe next day. I know people, they've been arranged for the next day and some people they've arranged for the last day. So all options are there and some people have been arranged on the same day. So just stay calm and they are definitely going to call you. If they are not calling, there is a number you can call them. So this is not an worry at all.
Cheers.
No worries. Okay, thank you so much for attending today. I hope that I had my feedback form ready because I thought to share some feedback form with you about this orientation because I'm thinking about keeping it like an annual habit. And of course, there would be some defects and shortage, and I want to improve. But it wasn't ready on time, so sorry for that. I might do it maybe next year. Best of luck all. Don't forget you have done very, very well. And now it's just a bit of orientation plus practice plus some body language and hand movement, and you will make it. Thank you so much and good luck, everyone. Oh yes, I will share the link in the different group that I posted. I initially advertised that in so many groups, so I'll share it in the same groups if they allow, and maybe tomorrow or after tomorrow. Okay.